Jen Burrell, Michael Bird, thank you both so much for joining me on New Mexico in Focus this week. Lou just laid out some of the numbers, dates, and broad strokes of the COVID pandemic, which hit our state in March of 2020. He also reminded us that Jen was one of, if not the first people to raise her hand publicly and say she'd tested positive for the virus. She actually did that in an interview with me at the Santa Fe Reporter, and she listed several concerns about the integrity and strength of our health systems even back then. Hell, she couldn't get tested even for a couple of weeks, even though she was sick. Jen, we'll get to some of the particulars of the criminal justice system where you work in a bit, but broadly speaking, when you think back 4 years ago, how has our society handled all of this in terms of how we treat one another?
Not well. Not well at all. Looking at it now, we're not dealing with people with long COVID. We're not recognizing the threat that is to our workforce. We're not dealing with it spreading anymore because we're saying there's a vaccine, so what's the big deal? We've seen, and obviously you can speak more to this, but the more times that people have COVID, even if they don't have extreme symptoms, the harder it is on their body and the likelihood they're going to have long COVID. And so we're not taking any of that seriously. We also saw during the pandemic that people who were incarcerated, we didn't really care about them. They weren't being tested for a long time, as you're aware. They weren't receiving treatment. They weren't getting masks. They weren't being isolated. None of that was happening. So we just gave a public-facing front in terms of our caring about it, but we really haven't even delved back to look at what we could do better next time.
Michael, if you had to give us a grade as a species for how we dealt with and handled all of this, what would that be?
Well, clearly it would be an F. In this country, it would be an F globally. I think there have been some countries that responded in a more affirmative, positive way and managed it much better than we did here. I think the sad part about all of this is that we already, and I'll just reference Lori, I'm not selling her book, but Lori Garrett's book, which was written in 2000, The Trail of Trust and the Coming Plague. And at that point in time, she was already writing about the risk that was already out there and the potential this had. And so fast forward, and it played out in many ways just exactly as she said it would. And so it's not like we didn't have national authors and other people involved and engaged in public health, raising flags and trying to start conversations about the risks, but we failed to listen.
Let's stay on that for just a minute, and I want to stay with you for just a moment too. I've talked to a lot of public health experts who sort of give me this picture that we did have a chance both before the virus arrived and after it arrived to really kind of take a chunk out of the devastation that it might have been able to wreak, right? But as a result of us not having a national strategy, the situation that we've got now is that COVID is endemic. Right. Is that an accurate analysis? And what does that mean that this virus is now endemic to our society from a public health perspective?
Well, I think that we clearly will be dealing with the epidemic and the ramifications across all of our society, be it the economics, be it public health systems, be it medical care. All of our major institutions have been impacted and continue to be impacted by COVID, and so this is really going to be a long-term. There needs to be a long-term commitment, and it's going to be, I think, a long-term recovery.
And in terms of it being endemic, it also just means that the virus is here and people are going to continue to catch it and get sick, yes?
Yes.
Gotcha. I want to talk some about how this pandemic has impacted some of our tangible and concrete systems. Jen, you're a public defender. Of course, that means that you work in the criminal justice system. And I'd like to give you a few moments to talk about the ways that system changed rapidly and massively, like in the moment in 2020, and what some of the ripples have been since then.
Yeah, and so when I was tested positive, I had just been at a meeting on how to address it with the judges, the law enforcement, all of that, and we'd all been crammed into a room, and then I get home and find out I'm positive, right? And because you couldn't not go to work, right? And if you didn't know, and so
later on we came to call those super spreaders, right?
Right, yeah. So thrilled about that. And but on the 23rd of March, they shut down the courthouses, and because of that, and because they didn't know what to do, right? So if we have a lawyer coming in and then they have contact with an inmate that goes back to the jail, I mean, you can just kind of do the chain of events, and so they tried to start implementing video court. So that at least some of the hearings could continue. There was even early on, one of my cases was one of the first ones in the first judicial district, where there was evidence presented by witnesses by video, which we objected to because we have the right of confrontation, and to be able to see who's in the room with them, to see how they're testifying. It was a very strange situation because one of the witnesses was deaf, and so the system they were using at the time, whoever spoke was the large screen, and so if somebody coughed, they were the large screen, and the translator couldn't see what was happening, and the witness couldn't see the translator because all of a sudden they were like a 1-inch square. And so those kind of dynamics were kind of flushed out. They moved to a more stable system, but it took a while for the judges to learn how to use it. We're still seeing people who are indigent and don't really have access to technology trying to access these systems. We still have judges who are saying, well, if you're not on, we're issuing a bench warrant, when it may just be a technology issue. And so we're seeing a lot more people arrested because they don't have access to the court, when before they could just walk in the front door. Now they have to have access to electricity to charge their device. They have to actually have a device, and they have to have service. Some people have a card that they run minutes on, but if court lasts 2 hours, their minutes run out, and then they're issued a bench warrant because they weren't there when their case was called. And so there's a lot of really practical applications that haven't been fleshed out in terms of how it's impacting people who are coming through the system. And they're now doing civil jury trials by video in terms of the jury selection, which I think is very suspect, and I'm hoping that it doesn't move into the criminal system, because trying to get people to pay attention in court is hard enough when they're not paying attention to their dog or just getting up and going to the bathroom. And part of the jury system is that they're there to take in every piece of evidence and to judge the credibility of the witnesses, and that's really hard to do when they're on a 1-inch little picture on your computer screen. And so I think it's kind of going in the wrong way. Private attorneys are very happy with not having to travel as much, as we're a very rural state, so they take cases in a lot of jurisdictions. And so if it's just going to be a 5-minute hearing and they don't have to drive 6 hours, they're very happy about that. So there are some benefits, but there's also some really drawbacks in terms of being able to communicate with your client, because you can't really talk to them when they're in jail, appearing in a room of 30 people, and you're not there next to them to be able to communicate. Those kind of issues are still being dealt with.
Michael, what are some of the other sort of tangible or concrete systems that have been impacted by all of this, and how has that played out?
Well, if I might, I'd like to sort of share a quote with you from an article, just briefly, titled "How America Lost the COVID War," because this provides a context. And I'll quote it. "It is best to think of COVID as a war, the most expansive global struggle since the Second World War. The U.S. fought the COVID war without an army or a battle plan. We met a 21st century global emergency with structures fundamentally designed for the 19th century problems, and it showed. Our scientific knowledge was unsurpassed. Thousands of people and organizations made heart-rending, life-saving efforts. Americans spent more public money on the crisis than anyone, yet the U.S. has suffered more casualties than any other affluent country, despite having the best access to remarkable vaccines." I think I'm sharing that because I think it's important to really understand the national context and global context as it relates to, I think, how it's impacted the public health system. To this day, what we're seeing is that, first of all, public health systems have never been be they national public health systems, be they state government, be they county or local government. They've never been adequately resourced. They've never been adequately staffed. And as a result of COVID, we've had many professionals, in fact, retire and leave those positions. So we have a structure that has been depleted, and that's what we're expecting and hoping will deal with any other complications that are a result of COVID. And there are plenty of other threats out there in terms of other potential infectious diseases.
It sort of feels like, and Jen, I'll let you proceed in just a second, but it sort of feels like, at least where the public health system is concerned, that when COVID hit, it was like placing a 50-pound dumbbell on a balsa wood structure, yes?
Yes, exactly. And I think the other part of this is that for those communities, poor communities, communities of color in New Mexico, Hispanic, Latino, Mexican, and American Indian, those communities and rural communities, particularly being at even higher risk, the structures that would support them in responding to COVID and getting what they needed in terms of education, treatment, and vaccines and everything else, those systems in some cases never existed and or were severely challenged.
Jen, you had a thought.
I was just going to jump in on what he was saying in terms of depleting the resources, because we do a lot of cases of competency, and so an order for an evaluation is usually done. In the first judicial district, there's only one evaluator who will do them anymore, one for 3 counties, and she will not go into the jails because, COVID, right? And what's not being addressed, and she's, concerned about her health issues, which I don't blame her, but we're seeing it degrade even further. How do we get a valid evaluation if they're not there with them, not performing the testing in person? And so, the reality is that what we're not willing to invest in those positions, so nobody new is willing to come in and take those kind of risk. And everybody else has either retired or said, I'm only going to do this with severe limitations.
We've got a couple minutes left, and we would be remiss in having this conversation without talking about the WHO. We've scratched at this a little bit from both of your perspectives in terms of which communities and populations bore this the worst, but who did bear this the worst, Michael, and why?
Well, from my perspective, it's always the poor and the marginalized and communities of color, and we've, and those are, it's poverty that underlies much of this. For Native communities, I think it clearly, if you look at the funding of the Indian Health Service, which has never been adequate, 50% of the level of need. You look at reservations here in New Mexico who still finally there's being some attention focused on infrastructure and internet connectivity, water systems, but forever, particularly rural reservation areas and rural New Mexico communities, they've not had access to running water. They've not had access to electricity, no internet connectivity. So, basically left out there, hung out to dry. And there's been no real commitment, in spite of all of the treaties and the executive orders that presidents have issued to address the issues of poverty and neglect. Not that much has been done to address those issues. So you have those populations who are at greater risk, always have been, continue to be, and I love New Mexico, and we talk about being multicultural and everybody's kumbaya, but there's still some very real issues that have not been addressed conveniently for whatever reasons. And I really think I think if we really believe in the value of human beings, if we really believe in a religious philosophy that says I am my brother's keeper, then we need to act on that. And I hear a lot of rhetoric, but I see a lot less action.
Jen, I've got about 30 seconds for you to follow up on what Michael said. Does some of this feel intentional?
I think it does. I think it's also based on, just making sure the economy is moving forward and forgetting about the humanity of the people. We had a person in our office, we have several tribal members from our office, and when they were locked down, they didn't have access to the internet. That's the first thing they got them before they got them running water. Running water would have helped protect them from viruses more than the internet, but we wanted to make sure they could work before they could be healthy.
That's all the time we've got for this segment. I really appreciate both of you helping us to take stock of these last 4 years. We'll meet back here in a little bit to talk about long COVID and some of the other lasting impacts this pandemic has had on our state.